Hi, this is Dr. Brenda Morthy, and today we're going to review how you should prepare for your breast surgery. So if you've been scheduled for a mastectomy and lymph node surgery, this is the correct video for you. At the Comprehensive Breast Center of Arizona, we pride ourselves in taking this journey with you. So let's dive right in on how to prepare for your breast surgery. So we'll review what tests you should get, what medications you should stop before surgery, when you should stop eating and drinking, and other important tips. So during the COVID pandemic, everyone will need to have a negative COVID test before entering into the hospital. So these are the facilities that I go to and the instructions of who will call you to coordinate that testing for you. If you're going to Honor Health Piper Shea or Banner Boswell, the facility will call you directly. If you're going to Honor Health Deer Valley, my scheduler will instruct you on where and when to get COVID testing. Many patients have questions of if their family members can wait in the hospital. I generally will ask you to direct these questions directly to the hospital, since this is a very dynamic process, and the recommendations do change sometimes on a week-to-week basis. So 5 days prior to your surgery and 2 days after your surgery, you'll stop any aspirin or prescribed blood thinners, fish oils, omega supplements, garlic or vitamin E supplements, or any herbal remedies. Again, this is a reminder slide. Don't take any anti-inflammatories like Advil, Motrin, or ibuprofen 5 days prior to surgery. You can take Tylenol until midnight before your surgery. If you're diabetic, you should take your diabetic medications the night before surgery. If you take insulin, cut the insulin dose in half. But on the morning of surgery, please don't take any of your diabetic medications or your insulin. If you're taking any of these blood thinners, you should stop them prior to surgery. If you're taking Coumadin, you can stop it 7 days prior. Eliquis should be stopped 2 days prior, and Plavix should be stopped 5 days prior. If your blood thinner is not on this list, please let us know. So the night before your surgery, don't eat or drink anything after midnight. You will be able to take your morning medications, and I would have reviewed which medications you can take in the morning with a small sip of water. When you're packing for the hospital, please leave all your valuables at home. Please remove any earrings, nose rings, any other piercings you may have, any rings, just because the metal can interfere with the surgical instrumentation. You should also not wear any makeup, no nail polish, no contacts, glasses are fine. You will need to have a driver. The hospital will not allow your surgery to go forward if you do not have a driver. So what do you need to know about your mastectomy and lymph node surgery? We'll talk about what happens during a mastectomy, what happens during a sentinel node biopsy, if you need to have more lymph nodes taken out, how does this occur, what happens after surgery, how do you care for your incisions and your drains. So mastectomy is when the entire breast is removed in order to remove your breast cancer. It generally also involves taking out some lymph nodes, and we'll go over how that's performed. Generally, people will have at least one drain in. This allows a collection of fluid that naturally occurs after any tissue is removed. These drains will stay in until you come to the office. You will keep track of how much comes into the drain, so that we will know when the appropriate time is for us to take them out. So we know that with cancers, the first place that cancers can go to are the lymph nodes under the arm, on that side of the cancer. So if you have left-sided breast cancer, we're worried about the lymph nodes in the left armpit. So what we do is, if we don't think there's any lymph nodes involved, we do what's called a sentinel node biopsy, which is a surgical procedure where we remove 1 to 5 lymph nodes. We'd send them to the lab, and we wait to see, is there any cancer in these lymph nodes? If there is any cancer in the lymph nodes, then we would take out more lymph nodes. If there's not any cancer, then there's no need to remove any more. There are a lot of lymph nodes in the armpit, but we don't want to, in the beginning at least, take out all of them. We want to see if there's any cancer that has spread to them. So in order for us to know which lymph nodes to take out, we actually will inject some dye around the areola. So we inject some radioactive solution around the areola as well as blue dye. So both dyes are injected, and that helps us to know which lymph nodes to remove and test. So if you're having your surgery done at Piper Surgical Center, then you will have your radioactive injection done either at Smile or at Piper, and my surgery scheduler will give you instructions on where that will be performed. I will send into your pharmacy some numbing cream, and you'll put that around the areola. So wherever this is in yellow is where you'll put the cream about 2 hours prior to your arrival to the facility. And then when you're asleep, a second dye is injected around the areola, and that's blue. So basically what happens is that the dyes are injected around the areola, and then these dyes will travel to the lymph nodes that are under the armpit. It goes to the first draining lymph nodes. And so with a special machine, I can detect the radioactivity. And of course, with the blue dye, the dye will stain those first draining gatekeeper lymph nodes blue. So these lymph nodes are then removed and then sent to the lab. The lab will test the lymph nodes while you're asleep. And as long as there's no cancer there, there won't be any more that's removed. Now, if you're having your surgery at Boswell or Deer Valley, both injections are done while you're asleep, so you do not need to get that cream. One thing to remember is the blue dye will turn your urine and stools blue-green for the first couple of days, so do not let that alarm you. So again, with the sentinel node biopsy, the injection is done around the nipple for the radioactive material, and the blue dye, it goes to some lymph nodes. Those lymph nodes are then removed and tested. If there's no cancer in those lymph nodes, there's no additional lymph nodes that need to be removed. However, if there are any lymph nodes with cancer in them, then we take out more lymph nodes. And so we call that an axillary node dissection, which is just a fancy medical terminology for taking out more lymph nodes from under the arm. People always ask me, how many lymph nodes are you going to take out? We don't know that until we get all of the lab results back, because it is a surgical area that is defined, and that's what determines how many come out. So the surgery that you and I discussed will be what we sign the consent form. If we're doing a mastectomy and taking out just the sentinel nodes, it's about 2 hours for one side. If for some reason we decide that both breasts need to be removed, then it's about 3 to 4 hours. Any reconstruction, which is done with the plastic surgeon that you would have already met, will add time to this surgical procedure. And any of the aftercare instructions will also be determined by your plastic surgeon. So once the surgery is over, you'll go to the recovery room for about 45 to 90 minutes. You will have, you will stay here until you either go home, but if you're having reconstruction, most likely you may stay overnight. So a mastectomy with taking out lymph nodes is a day surgery if you're not having reconstruction. If you are having reconstruction, your plastic surgeon will discuss with you whether you will go home or not that day. If you are having, if you're having plastic surgery, plastic surgeon will give you prescriptions for pain medications. Otherwise, I will do so. You will also have a follow-up appointment about 2 weeks after surgery. That's when your pathology report will be discussed with you. If we get the results earlier, either myself or Marcia, who you've already met and is my physician's assistant, will call you. Appointments to other oncology team members can be made about 2 weeks after surgery. I will go ahead and make those referrals before your surgery so that we can just move forward in getting those appointments made. A lot of times it's confusing to people. Why are there so many oncologists? I'm a surgical oncologist, so I do the surgery. There's a medical oncologist who prescribes medicines, so that includes hormone blockers or sometimes even chemotherapy, and then a radiation oncologist who administers radiation therapy. A mastectomy incision goes across your chest. If you're having if we've discussed lymph nodes being removed, sorry about that. If you are having lymph nodes removed, then that would occur through the same incision. The incision is closed with dissolvable sutures. You can see here the drain coming out. If you're doing it with reconstruction, this is sort of what the final product looks like. It's not necessarily what you'll wake up looking like. Most of the time it's a little bit flatter than this, but again, you can see the incision. The lymph nodes are removed through the same incision, and the incisions are generally closed with dissolvable sutures, and there will be at least 1 to 2 drains. So we generally do not have you shower until 48 hours after surgery. Please avoid soaking the incisions. You can remove the dressings and shower. If you're having surgery with a plastic surgeon, please make sure you understand what their post-operative instructions are. If you have a lot of swelling around the incision, make sure you call our office. Infection is not common, but it can happen. Things to look for is redness, discharge, or a fever that is over 101.5 for over 1 to 2 days. We always have a physician on call, even at night and on weekends, and that our office number is 602-374-3440. After your surgery, you can get a post-mastectomy camisole. And you can get those at the prosthetic stores, and you would want to do this if you're having plastic surgery. You would want to make sure when it would be okay to do this with your plastic surgeon. So how do you care for your drain after surgery? And what are Jackson-Pratt drains? So anytime tissue is removed from the breast, the body's normal response is to fill up that space with fluid. And it can be very uncomfortable if we weren't going to give that fluid a chance to come out. And so that's why we insert a drain. And so the drain, part of the drain is in the body, while the tubing and the bulb sit outside of the body. In general, you'll have at least 1 drain and sometimes 2 drains. So they are stitched into place, and it helps to prevent fluid buildup. A lot of times you can see blood clots, red blood cells, or tissue in the drain. That's normal. The color coming out of the drain can change over time. Sometimes we will ask you to strip the tubing every few hours just to make sure there's no clots that accumulate in the tubing. We want you to empty the drain at least twice a day, or also when it's full, and you will record the amount that you are emptying. If you have 2 drains, you will number the drains like 1 and 2 and measure or record the output of each drain separately. So I'm going to show you a video now on how to care for your Jackson-Pratt drain, and you will keep track of how much comes out, and then you will bring that sheet to the office with you so we can see how much is coming out and whether the drain is ready to come out or not. If you have a plastic surgeon that has been involved, the plastic surgeon will take care of removing the drain. If there has been no reconstruction and there's no plastic surgeon involved, then I would take care of the drain.
This video will show you how to milk the tubing of your Jackson-Pratt drain, empty the drainage bulb, and record the drainage. You'll want to make sure you have all the supplies you need in front of you. You'll need a measuring container, an alcohol pad, and your Jackson-Pratt drainage record. There are 2 parts to your Jackson-Pratt drain, the tubing and the bulb. Before you empty the drainage bulb, you'll need to milk the tubing so it can drain properly. First, clean your hands. If you're washing your hands with soap and water, wet your hands, apply soap, rub your hands together thoroughly for 15 seconds, then rinse. Dry your hands with a disposable towel and use that same towel to turn off the faucet. If you're using an alcohol-based hand sanitizer, be sure to cover all of your hands with it, rubbing them together until they're dry. Cleaning your hands properly, also called hand hygiene, is an important part of caring for your drainage catheter. Now look in the mirror at the tubing. Pinch the tubing close to where it goes into your skin. You may want to use an alcohol pad to make it easier to slide your fingers down the tubing. With your thumb and forefinger of your other hand, pinch the tubing right below your other fingers. Keeping your fingers pinched, slide them down the tubing. Keep doing this until any clots are out of the tubing and into the bulb. Once all the clots are in the bulb, you're ready to empty it. unplug the stopper. Then turn the bulb upside down and gently squeeze it, pouring the contents into the measuring container. Now turn the bulb right side up. Squeeze the bulb enough so that all the air comes out, and keep squeezing it while you replug the stopper. The bulb should remain compressed so that it provides continuous, gentle suction. The stopper must be closed for the drain to work. If you're wearing a surgical bra, attach the Jackson Pratt using the Velcro straps. It's important that you never let the drain dangle. Check the amount and the color of the drainage in the measuring container and write both on your Jackson Pratt drainage record. Note the measurements on the container are in millimeters, MLS for short. If you have more than one drain, measure and write down each one separately. Remember, the color and consistency of the drainage will vary. It might be dark red, the color of cranberry juice, or a yellowish straw color. If the drainage is bright red, you should call your surgeon's office right away. Empty the drainage down the toilet and rinse the measuring container with water. At the end of every day, add the amount of drainage for the 24-hour period and write it down. Remember, each drain should be recorded separately.
Thank you for choosing the Comprehensive Breast Center as for your surgical care. We will take very good care of you, and I hope you found this video helpful.